Hello, and welcome to a special edition of McGill Cares, a weekly webcast series addressing a wide variety of topics to support family and informal caregivers. I'm Claire Webster, a former caregiver who became a certified Alzheimer care consultant and founder of the McGill University Dementia Education Program. McGill Cares is part of the McGill University Dementia Education Program, and I work with a dynamic team of leading healthcare professionals to oversee this program, which include Dr. José Moret from the Division of Geriatric Medicine, Dr. Serge Gauthier, McGill University Research Center for Studies in Aging, and Dr. Gerald Fried, McGill Steinberg Center for Simulation and Interactive Learning. These webcasts are made possible thanks to the generosity of our donors and sponsors. Today, I have the great privilege of speaking with Madame Marguerite Blais, Minister responsible for Seniors and Informal Caregivers. Madame Marguerite Blais occupe depuis octobre 2018 le poste de ministre responsable des aînés et des proches aidants à l'Assemblée nationale du Québec et de députée de Prévost pour la Coalition Avenir Québec. Après des études supérieures en musique et quelques années en enseignement, Madame Blais a fait des études supérieures en communication et a travaillé avec succès pendant 30 ans comme animatrice et journaliste à la radio et à la télévision. Impliquée auprès de nombreux organismes de bienfaisance, elle a fait son entrée en politique en 2007 en tant que députée libérale à l'Assemblée nationale du Québec pour la circonscription de Saint-Henri, Sainte-Anne à Montréal, un poste qu'elle a occupé jusqu'en 2015. Thank you so much for coming on McGill Cares, Madame Blais.
Thank you for your invitation, Claire. And it's a pleasure for me to be with you and to be with the people who are listening to us. I have the privilege to meet you a few years ago, just before I came back in politics, and we discussed about the needs for caregivers. And we discussed about how important it is to give formation for caregivers and to be able to support them. So it's a nice, comme on dit en français, a nice souvenir pour moi.
Yeah, and I was very, very grateful for you to take the time to meet with me because, I've over the last few years, I've been an advocate for caregivers, and there's a few people that I, really looked up to and wanted to understand their passion for the advocacy, because every day that I do my work, I don't consider it work, I consider it a passion. And you're one of those people that I really looked up to. I wanted to really give people an opportunity to get to know you, because behind every politician is a human being. And I'd love for you to talk about your personal journey as a caregiver and really the emotional and physical impact that it had on you.
Well, it was in 2014. I was married with an angel for 37 years. This man was so incredible. And from one day to another day, you never know what's happening in your life. And, we discovered he had a brain cancer and a glioblastoma, which, there is not too much to do. And the doctor said he had for 4 to 6 months to be in life. And, you cannot believe this. It's like something incredible. And when you are in hospital, all the hospital, the nurse, les préposés, everybody is taking care of the person who is sick. And as soon as the person leaves the hospital, you discover that you become a nurse, you become a pharmacist.
Pharmacist. Yeah.
You discover you have to do everything, and you don't have the tool to be able to do it, and you don't know. You really feel desperate. You feel like, what am I gonna do? And my husband also said, you're the only one who can take care of me. So you become in alert, 24 hours a day. When my husband wanted to go to the bathroom, I knew he would fall down. So I was not sleeping for months because I was watching him. But, you know, I fell in love more with him during the last few months because I discovered that love is not, it's not loving someone who is beautiful. It's loving the heart, the soul of the person. And even if my husband was losing his full of autonomy, every day I was loving him more, and I became a part of it. And, you know, at the end, he was in les soins palliatifs, une maison de soins palliatifs de la Rivière-du-Nord in Saint-Jérôme. And for me, it was an incredible experience. And he died in my arms. And it's just like if I went through the mirror. I went on the other side, and I didn't want to come back in the world of the people who are living, you know. I just wanted to stay with him. And my husband and I, we adopted 3 kids, and we also sponsored 3 kids. So we have 6 persons around us from all over the world. And my daughter from Peru told me, Mommy, you have to come back for us because we need you and your grandchild is needing you. So I had to come back, but I didn't realize I did a burnout because you don't realize this as a caregiver that you go too far and you don't want anyone to help you and you think you're strong. And I have been a minister, so I'm strong and I can do everything myself. But I realized I was very, very, very tired and I didn't know what to do. And I quit politics in 2015. I couldn't stay there anymore. I wasn't interested. I was no more a minister for seniors, but that's okay. It was not really this reason. It was mostly because all my value had changed with being a caregiver. And, you know, to come back in life, I decided to write. Some people, they do therapy. Other people, they paint. Other people, they sing in a choir. I decided to write a book, and this book was like a therapy for me. And after that, I did a lot of conference about what I had lived with my husband. And 2.5 years later, I decided to write a book about caregivers because every time I was doing a conference, I was seeing people who were crying, and they were crying because what I was saying, it is what they were living. And
what you said before about, you know, when you started to take care of your husband and he said, you know, nobody can take care of me except for you. You know, that's a tremendous amount of responsibility that caregivers face. And I think, you know, and even without a loved one saying that to them, that's the responsibility that most people feel, most caregivers feel, that, you know, they don't have permission to have a life other than caring for their loved one. So how did right? They don't have permission because they feel like, so how did I mean, that's like, you know, for myself, it was the same thing. I mean, caring for a mother who had dementia and then all the responsibilities and life decisions that I had to make. And like you, I said, well, I'm her only daughter. It's up to me. It's my responsibility, nobody else. But then we sacrifice ourselves, correct? Like, how did that impact you, that weight of responsibility?
Well, at one time when you lose your autonomy, and I'm sure this thing happened to you, to see different people coming and give baths and cleaning the person, they feel they don't have intimacy anymore. Mm-hmm. So my husband didn't want other people to come and, give a shower to him. So I had to be there because I had to preserve his intimacy. Mm-hmm. But in the other hand, at one point, I was not able to do it anymore. Otherwise, I would have hurt myself and hurt my husband. He was really losing his total autonomy physically, and not mentally, but physically he was losing his autonomy. And you feel you're responsible for all this. And, you know, I was telling you that I saw people who were crying when I was talking in conference, and I decided to write a book, and which I did. And at the end of the book, I said, the government, and it was during the election, just before the election, and one political party, they have to engage themselves to do something for caregivers, because we have 1.7 million caregivers in Quebec, and you know, somebody has to take care of them also. Otherwise, it's not possible to go on and to go on. They have too much responsibility. What is the frontier between the responsibility of the caregiver and the responsibility of les cis et les cieux? You know, you have to, what is the transgression? So far you can go in this transgression, you know. The majority of caregivers, they don't have any formation in medical, you know, aspects. So, you know, they becoming, you know, specialists in everything from one day to another. So anyway, I didn't want it to come back in politics anymore. I had said it was finished, it was over. I was too old, and it was not my cup of tea. But when I met François Legault and I talk about caregivers and to be able to give more respite and to do a politics and action plan for caregivers, François Legault said yes. So when he said yes, I said, well, I have to go back. I have to fight for this. You know, it's like, my husband deserved that, and all the other caregivers in Quebec deserve that. And that's why I came back in politics, you know, to do something for caregivers.
So like my own personal experience was, I mean, I've been working in the field of dementia care for a long time. And, you know, in 2006, when my mother was diagnosed with Alzheimer's disease, I received absolutely positively no information whatsoever from the doctor about the disease, how it was going to progress, nothing. And which resulted, I really believe that the lack of education had a significant impact on the quality of care that she received and her safety, as well as, most importantly, on my own health and well-being, and the ripple effect that it had on my family and my health. And, you know, and I today, fast forward, I see a lot of the same situation in the field of dementia, that there's just not enough education provided for families. And you know, that's what motivated me to become an advocate on behalf of caregivers of caring for loved ones with dementia. What would you like, what was that defining moment though, that made you say, I want to go into politics, I want to be an advocate for change? Like, because there are thousands of caregivers or millions of caregivers, but not everybody decides to go into politics or becoming, you know, like I changed my profession to do this. But what was that defining moment that said, you want to go into politics, you want to make a difference?
Well, after I spoke with François Legault and his wife, you know what? People always talk about power. Who is the politician who has the most power? Is it the Minister of Health? Is it the Minister of Finance? The person who is really in control of everything, it's the Prime Minister. And François Legault said yes. So I said, okay, I'm going to go with him. I'm going to try. And he won the election. And if a prime minister doesn't have a goal for old people, old person, and caregivers, nothing you can do, even if you go back in politics, you know, because the person who really takes the decision at the end is the prime minister. And, well, he won the election. I'm there. I have caregivers in the name of my, you know, status of minister, so I can do something. And let me tell you, a bill for caregivers, it was not especially in the plan. We have talked about it, but it was not so clear. And when I present the bill to François Legault, some people said, we don't need a bill. A politics and an action plan, it's going to be enough. But I said to the Prime Minister, we need a bill. And he said, why? And I explained to him why. Because, you know, it's not a political thing. We're going to be able to really cement a politics and an action plan in a bill. We're going to be able to mention that we have to take care of the health and the well-being of a caregiver. And this is strong as an action. We have the responsibility to taking care of the health and the well-being of a caregiver. And the caregiver has to become a partner of the health services. And the caregiver needs also to have a plan. You know, we take care of the person who is sick, but we also have to take care of the caregivers. We don't want a sick person. And the caregiver has the right to be a partner in the plan of the person who is sick. So when I explained that to Mr. Legault, and he said, yes, Marguerite. And, you know, I deposit the bill, and we're going to be able to have a commission parlementaire and to talk about this. But we are going very far with our bill. And there is not so many jurisdictions all over the world who has a bill for caregivers. It's going to change the face of the way we see caregivers. And also every ministry will have to take in consideration caregivers when they will deposit a bill, law project, or when they will also deposit a new reglementation. So that's a major change. Mm-hmm. So it's going to be more than a politics and an action plan. It's going to be something new for all Quebecers. And I think for me, it's fun to have been coming back in politics for this, you know. So in my way, I'm an advocate. I'm doing advocacy in a way.
So I speak as a former caregiver, but also I've worked with hundreds of caregivers over the last 14 years, first as a volunteer and now as a professional and with McGill, you know, and I think that right now the biggest challenge for caregivers I see is just no matter what type of disease they're dealing with regards to caring for a loved one, is a lack of education, like not having the tools to take care, not understanding the diseases properly, not knowing, you know, physically and cognitively how to handle it. But also, I think one of the biggest challenges right now, and it's not only in Quebec, I would say this is provincially and globally, is most important, how to navigate the healthcare system, how to access resources, not knowing the process, where to go. So, I mean, that's what I see on my day-to-day work with people, like just not knowing, like lack of information, lack of communication, really not understanding. In your experience, both professionally and personally, what would you say are the biggest challenges that caregivers face?
Well, I think I told you in my precedent answer, it's to take care of the health and the well-being of the caregivers. Mm-hmm. You know, this is a major game changer. The government will have this responsibility. And we will also have an observatoire, scientific observatory. Mm-hmm. this is also something important because we will be able to collect data. We will be able to do research. We will be able to help the people who are working with caregivers. And also, you know, when you have a policy and an action plan, you also have money to be able to do things, to be able to take care of caregivers. If you don't have any money, what do you do? Mm-hmm. So we will have some money also to take care of caregivers. And we will have in every region of Quebec a coordinateur, one person who's going to be responsible to organize all the services around caregivers. And as you know, Claire, there is also les appuis au proche aidant. Mm-hmm. You know, I organized this in 2009, and everybody was afraid that it will disparate because disparaître.
Oui,
how do we say that?
It's going to disappear. Disappear.
But it's not going to disappear. It's going to stay. It's going to be a little bit different because les appuis was only for caregivers who takes care of senior citizens. But now it's going to be for all caregivers. So we are opening larger. We know there is a new reality right now in Quebec and perhaps in other countries. Family who had some children with a disease, they used to die young younger. Mm-hmm. Like les trisomiques, their expectation of life was around 21 years old. Mm-hmm. Now they can live until 65 years old. Mm-hmm. And the mm-hmm. parents, sometimes they are very, very, very anxious. Mm-hmm. They are afraid to die before their own child. Mm-hmm. So we have to take this new consideration. And also, you know, right now in our CHSLD, more than 80% of people who are living there, they have neurocognitive, trouble neurocognitif majeur. Hein? So they have Alzheimer's disease, they have Parkinson, they have these type of disease. So, you know, it's a new trend. So we need to have different type of caring and curing people who are aging and also people who have some type of disease and who are staying with their parents who are aging themselves. So we have to take care of them.
So talking about the long-term care, I know that prior to the pandemic happening, you know, what I really was impressed with what you were doing is you started doing these surprise visits to the long-term care centers. You know, I follow you on social media, and I liked the way that you had taken that initiative to just suddenly show up at the long-term care centers to make sure that everything was happening the way it should. But, you know, unfortunately, the pandemic uncovered what they call Pandora's box. So what do you think really needs to be done now to ensure that, you know, the quality of care will be continuously there moving forward in the long-term care, not only in the public system, but in the private system?
Well, a lot of things. Before the COVID-19, we had started to think about all the CHSLD privé, you know, the private CHSLD come like Iran and all these things. Mm-hmm. We wanted them to be convention CHSLD because they didn't receive the same amount of money, you know, to take care of someone than in the public, you know, field. And how can you, if you receive 185 per day compared to 250 or 60 per day, how can you give the same quality of services? It is impossible. So we have started to work on this. We have started to work on the fact that there is so much CHSLD who are Vetuste, I don't know what to say that in English, but who are old, very old, too old. When you are living 2 or 3 persons per room, this is, this is not correct. We have to change this. And we were working on les maisons des aînés who correspond exactly to people who have Alzheimer's disease, like small units of 12 persons, always working around 12 persons, and a big room and individual shower with adapted and toilet. And we were working with this, and we were working also on the first policy on hébergement and long-term care facilities. And we didn't have time to deposit this. The COVID arrived, but we knew that we had to do this. And now we know that we have to really go on les maisons des aînés and also give more services at home. Everybody wants to live in their house as long as possible. So that's why caregivers are so important. So we have to help caregivers to be able to help the person who is aging or the person who has an handicap. So we have this responsibility. We know what to do. But unfortunately, the COVID arrived and it was a disaster. And it broke my heart, it broke my heart.
From what I can't, like I said earlier on, I know you were one of the first people that I thought of, because I know your commitment towards people, towards seniors, towards the caregivers. And, having lived the journey myself, I think that, investing in really good education of the health of your professional caregivers and family and informal caregivers is key, because the reality is the majority of people are caring for loved ones at home, and they really need to be properly educated. And that's why we're pushing, we're at McGill, we're doing so much work with education and support for families. I have one last question for you, and because this show is really about supporting caregivers, based on your personal journey, what would you say are the most important lessons that you've learned, and what advice would you share to caregivers that are currently going? You talk about self-care, but what would you say to caregivers listening to you?
Not to be stubborn, like I was. Go and get some help. Otherwise, a caregiver can lose, a lot of things, can become sick, mental sick, I think it went on my head a lot when my husband died, because, I thought I was a superwoman. Nobody is Superman and Superwoman. So we are starting to have more and more service. And as you mentioned, Claire, I think that formation, education is the most important thing. And we need this type of support. And we have all, you are very implicated with Alzheimer's disease. And we have all these Alzheimer's Society who are doing wonderful work. And we have les appuis, and we have way more services than we had before. So we need to ask help. Sometimes we don't want to ask other people to help us because we are too proud. So that's not a good, that's not a good way to do things. Don't do like I did. Please, use the services who are there, and also listen to people, who went through a certain situation of being a caregiver. They can share with you the good things they did and the other things that were not so good for them. And don't lose your life because you are helping someone before. Because when a person will die, you're going to stay by yourself. and you need somebody has to take care of you, and you are the first person who can take care of yourself, you know. Nobody else can do it unless, you know, you take care of you, do exercise, take a walk, go and swim, do an activities with and share, you know. Even if we have a problem right now to be with groups, but we can read, we can walk, we can, you know, Claire, what I'm trying to say is to do an exercise, you know, just to get going on again, you know.
I can't agree with you more in terms of, you know, taking care of yourself. My mother passed away in 2016, and I say this often in my webcast, how I had used many different types of coping mechanisms to manage my stress, because like you, I thought it was Superwoman, and, you know, refused to get the support that I needed. And, you know, I was coping with too much alcohol, and, you know, and then I kept saying to myself, oh, you know, one day when I'm no longer a caregiver, I'll be better. But what I think people really need to understand is those coping mechanisms don't just disappear. And, you know, it's been 4 years that she passed away, and I'm on a journey now in my life where I'm recovering from those coping mechanisms. But, you know, there really is a ripple effect. If you don't take care of yourself, there will be a ripple effect on your own health. There'll be a ripple effect on your family, on the people around you. So, you know, caregivers are the most important resource in terms of caring for the person that you love. And you do have permission to have a life. You really, really do. Madame Blais, thank you so much for taking the time to meet with us today. And, you know, we had some technical difficulties at the beginning, but you came back, and I'm so grateful that you took the time really to meet with us today. And I'm so happy that people had a chance to get to know the personal you. You know, when I had lunch with you a few years ago, I was just amazed at all the people that kept coming up to the table and thanking you. You weren't in politics at the time, but people just kind of came up and were just thanking you. So, you know, I really want to thank you for your commitment.
Madame Webster, I'd like to apologize if my English is not perfect for everybody, but I try my best today.
Well, thank you so much. And I would like to let everybody, thank you so much for being on the show today. And please join me on Wednesday, July 29th, which is on 2 days from now, for Much Too Young, the Impact of Early Onset Dementia. And my guest will be Chris Wynn, who is a former caregiver, documentary filmmaker, and Alzheimer's advocate, and also a good friend of mine. This webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. To make a contribution or for more information about our program, please visit mcgill.ca/dementia. And if you have specific topics or questions that you would like to address during our weekly webcasts, please email us at dementia@mcgill.ca. Until next week, take good care of yourselves and your loved ones. Thank you.